of how cholera changed my village. Tiny germs of cholera, too small to see, spread through the river. So small, yet so dangerous. Without realizing, women carried cholera home in the water. Flies carried cholera on their feet. Unwashed hands spread it too. We swallowed cholera germs in our water, on our food, and on our fingers. It happened so fast. By morning, my father was very sick. He had diarrhea that looked like gray water and poured out of him. I was so scared. I went for help. I never rode so fast. One look at my father and the nurse knew it was cholera. We had to work fast to save him. We made a special drink to help him. First, we made the water safe. We filtered it through cloth and boiled it for 1 minute. Then we mixed half a teaspoon of salt and 6 teaspoons of sugar in 1 liter of this safe water. It tasted like tears, not too salty. I worried my father would die before my eyes, but he soon felt a little stronger. The nurse explained to me that not everyone who swallows cholera germs gets sick like my father, but they can still spread the disease. Now I needed to take safe water to my village and teach them how to protect themselves from cholera. I saw a girl carrying water. I told her she could make the water safe by adding chlorine drops and waiting half an hour. There was a man about to eat with unclean hands. I told him to always wash his hands with soap and safe water after going to the toilet. Only with clean hands could he eat safely. I saw villagers spreading cholera into our river. I told them we needed to dig latrines far from the river, at least 30 meters away. This was important to keep our village clean. I found a mother preparing unsafe food. I told her, first, we must wash our hands with safe water. Then, we had to wash and peel the food, cook it and always eat it hot, and protect it from flies. I spread the word throughout my village and ran to find my father. I was so happy to see he was better. Our village became healthy. Now we filter and boil our water to make sure it is safe. We always use latrines and always wash our hands after. Food is safe from flies, washed and peeled and cooked. And we always wash our hands before cooking and eating. We made our village safe from cholera. Spread the word. Your village can be safe too.
Children Emergency Fund. Open defecation has a devastating effect on public health and increased child mortality rates. Olushola Babalola, the Executive Director, Center for Environmental Sustainability and Development Awareness, a non-governmental organization, has created awareness in order to curb the menace of open defecation in the society.
Like we all know, the cross of our project is all about open defecation and its attendant effect on humans, most especially the children below age 5 years. So it's a 6 month project that we kickstarted sometimes in September. So and we end which ended last month in March. So and it has been so interesting, implementing that project. Just like you said, the whole essence of the project is to make sure that we curb the menace of open defecation in our society, and our targets are market and motor parks, as well as other public places like under the bridges and bus stop. So far, so good. The findings with regards to our project, it's very, very an interesting one, in the sense that we find out that in some of these public places, they lack toilet facility, and in some places they don't have water supply. And we all know the effect of absence of water in the fight against open defecation.
He also identifies some of the problem encouraging the practice of open defecation.
Even when you have a toilet and you don't have the water, it's as good as you don't have. So in markets and parks that we have visited, we find out that they have limited, facility in terms of toilet. So oftentimes some of these facilities are not inclusive. Inclusive in the sense that yes, there are other category of people or classes of people that are in the market and motor parks, that are not people we call PWDs. So the issue of social inclusions are not even factor in some of this, facility, which allows, every category of people to make good use of the toilet. So where they have, that is not factor. A good example is the use of ramp. So in markets, in motor parks, you don't get to see things like that in the market. Then again, as much as government has invested a lot in terms of environmental sanitation, so you find out that they still need a lot to do in terms of toilet deficit. So when you see some of these public utilities, the toilets available are not commensurate.
Hafsat Mustafa, who represented the British Council, said sanitation and health is very important as open defecation exposes people to danger.
These are things that happen in our society. Everybody knows that once you defecate openly, you are exposing other people in the environment to certain dangers, So, and like he has said during his presentation, sometimes it's as a result of non-availability of water or toilets for people to use. So it's a call to action for both citizens and government. Government, public utility, public toilets would be provided by government. Where government cannot provide it, public-private partnership, like they've said in this room, is very important. People can come up with ventures or interventions that would ensure that the service is there. I'm sure there would be people willing to pay for these services, and nobody wants to live in a dirty environment. It's just when people don't have alternatives, they don't have opportunities, that's when they take the extreme.
She also called on both government and the citizen to take action on people who break the law of open defecation.
And again, one very important thing that I think we should be emphasizing on is punitive measures. To be honest, I think in Nigeria, we need to take drastic measures on the people who break the law, people who constitute nuisance in our society. This is really very important. It's not being mean when you ask somebody not to defecate openly and they argue with you, because it's not the right thing. I know that I will not do it, no matter how pressed I find myself. I will not do it. And when you find yourself in a very critical situation of need, you would find answers. So sometimes you probably would look around and you see a house where you can go into and say, please, can I use? That's being responsible. Like Mandate Health said earlier, I never thought about it, but it looks like people who are conditioned to do open defecation actually have mental health issues.
The president mandates health initiative empowerment. Ahmed Zion says open defecation should be a great concern to everyone as it does not only affect the physical state but also the mental state.
There's actually a clear nexus that connects these two together. When you see an individual that consistently, without minding the environment, without minding the people in the society, and on a continuous basis, is always engaging in open defecation without even taking a thought to the health of himself or the health of the people within that vicinity, or the health of the people that we live in along the shores or the waterways where these defecations, might pass through, is really a concern, and is something that we must see the connecting dots, to the health, in terms of physical health and mental health of Nigerians, and we should not excuse this out. One of the direct impact of this open defecation is the vulnerability of the individuals in those vicinities or those areas to be exposed, to diseases. And one of it, can be what we have always seen: cholera, diarrhea, and again, apart from the physical diseases or communicable diseases that are actually open or vulnerable to the individuals in those society, again, you will find a connecting dot to the mental illnesses or mental disorders that these particular populations, are vulnerable to.
Chief Felicia Sani, the national president of Market Men and Women Association of Nigeria, urged the private venture to help shoulder the responsibility of curbing open defecation, thereby creating jobs while trying to eradicate this menace.
You don't kill yourself with your hand. Don't kill yourself with your hand. That is the advice. That you don't urinate. The smell. That is what you are saying now. It's not even cholera. Your health, smell, the children health too. Everybody is at risk with what is happening in this our country. So the best thing is for us to control ourselves. Don't spoil the town. Don't urinate anyhow. Get a place, no matter how bad it is. It doesn't mean you are so pressed. Uh-uh. It's not good now. So my advice is that as government is helping us, we should help ourselves. We are saying that there's no work, and this thing can create million jobs for Nigerians. They say there's no work. It's not true. There's work. We can create millions of jobs. Look at the little one I'm doing. I know how much I'm getting from it. So let us create job, uh, build toilets. If government don't have money, let private people take up the responsibility, build toilets, and pay a token fee so that they use it to pay their salary. There's work. In Abuja, we can employ comfortably. We can employ 20,000 people in this town. The graduates don't have work. We can give them supervisor, buy car. Do you know how much I'm getting for my own small toilet? I'm getting 15,000 every day. Yes, for 7 toilets. And I employed uh, 5 men. They will work from morning 5 o'clock to 4. The remaining one, 4 to 10. I've created employment for people. And let us give employment to our people. This can give you employment, even in the rural area.
Dorcas Olariwaju, Voice TV, Nigeria.